I had clear lens extraction done by Dr. Pascucci. Yes, it is a pretty big decision to do it without a medical need to do it in real terms, because you can get by with glasses. I could have gone into contacts, although the prospect of sticking things in and out of my eyes every day is not attractive. So there's an element of frustration. It wasn't really cost driven. It just seemed to me to be something that I thought that the risk-reward ratio was much higher on the reward side if it worked, in terms of, you know, being able to function without having glasses around me all the time. And also a minor secondary reason was that it takes away the chance of having cataracts in the future, and the statistical chance of having cataracts as one gets older are very, very high. So at some stage eye surgery will come to most people anyway, so I thought, why not do it while I'm younger and get the benefits for hopefully quite a long time. Before I got into it with Dr. Pascucci, because a neighbor, a German lady who's very particular about everything she does, she had it done about 3 years ago. She recommended it highly. That planted the seed, so a couple of years later I was thinking of doing it myself, and Dr. Pascucci was one of the first people that I researched into, because from my point of view, personal recommendations when you're going to get someone sticking things in your eye is a good place to start. Well, I mean, I had typical old man's eyes, in as much as that I couldn't read without prescription glasses, and the distance vision was okay but slowly deteriorating, so I ended up with varifocal glasses. So I had a set for in the house, then sunglasses, and then a specific set for computer reading, because I wanted to see the whole screen when I'm working on the computer. So I was changing 3 sets of glasses almost every year, and forgetting them, leaving them lying around and all that kind of stuff, which was driving me nuts. Yeah, sports, I play a lot of golf, and again that was irritating, because varifocal lenses, playing golf, you've got the 3 zones, so when you put the ball on the tee and look down at it, it's off-putting, because it looks almost like it's moving, because you need it to be in the vision and then move up for the distance. So I basically couldn't wear my prescription sunglasses to play golf, and in Florida that's a problem. Well, I looked into lenses before I actually came to see Dr. Pascucci, and you know, there are various types of lens in terms of single focus or ending up with the multifocus lenses. And the logic to me was, if you're going to do this and get rid of glasses, to go for the multifocal lenses. And Dr. Pascucci explained the differences between the 3 types that he basically would use, and I opted for the Technis lens because it seemed to, from my point of view, with a combination of different circumstances, night driving and so on, seemed the best lens to go for. I had the procedure 7 weeks ago now, and I've got on very well with it. The reading was effectively almost instant. Within the first 10 days I was reading without glasses at all, and the distance vision has improved. I stopped wearing glasses almost within 2 weeks for anything, and the distance vision has continued to improve week by week, and according to Dr. Pascucci, should continue to do so you know, for another 2, 3, 4 months, however. But you know, if it didn't improve very much from where it is now, I wouldn't be disappointed. Played golf basically since after the first 3, 4 days. I mean, we're straight back to playing golf, and it hasn't improved my score, but it's made it a lot easier. And now I can wear sunglasses, you know, plain sunglasses when the sun's really strong, and that is a bonus when you're playing golf down here in Florida. With driving, during the day is the same. At night, I do get some minor ring effect around traffic lights and oncoming headlights. That was, I won't call it bad, but it was a little bit impressive for the first 2 or 3 weeks. But again, as time goes by, that's diminishing, and it was one of the questions we went into as to whether that would be an irritation for me if that stayed as a permanent feature. And the reality is, if it stayed again where it is now, it wouldn't be a problem at all. It's not dangerous. It's around Christmas time, it's quite pretty. Dr. Pascucci himself has been great at follow-up in terms of doing it personally, not being called after the operation to say how you're getting on by a member of staff. He did that himself, which I found impressive. And it will be hard to think of an area where they could really improve in real terms. you know, I've been seen on time, haven't had to wait around. I mean, there hasn't been an area where I thought, well, you know, that's not really up to scratch. It's been really good. If someone was to ask me whether I would recommend having talked, because people are always interested when you've had things like this done, especially as I don't need to get it done, I wouldn't have any hesitation in recommending Dr. Pascucci in his practice. In fact, I already have to 2 or 3 people who have expressed interest, and one of them seeing him next week.